EHR, and one of the things that I think all of us have been dealing with, I mean, that's been a lot of fun for all of us, dealing with the EHR and the rollout of EHR, and I'm really happy to know that we're almost completely converted all of our medical professionals into data entry specialists, so that's been good with that project, or those projects. But also the EMR is taking up a lot of real estate in the minds of folks, and as we're moving past that, I'm kind of interested in knowing where you see, what are the next big things coming out of that? Is Epic and those folks going to pretty much gobble up the world and there's no more innovation and we should be just looking for them for innovation? Or are there other places where innovation is going to grow? And
yeah, so absolutely, the EHR ecosystem and discussions are sucking out oxygen from a lot of places. And the biggest mistakes that we can make is to treat the EHR as the centerpiece of our technology strategy. Huge mistakes are being made because of that. Not just because of money or anything else, but realistically, EHRs over the last 25 or 30 years have been more like retrospective documentation management systems. And to expect that retrospective documentation management systems will become the future of prospective, immediate time, realistic clinical systems is very, very difficult to believe. So absolutely do not depend on any single vendor of any sort. Whether you say, it'd be like just as silly to say, well, let's take our supply management system or our materials management system and make that the centerpiece. Or let's take our financial management system and make that the centerpiece. It's just as bad to say, let's take our EHR and make that the centerpiece. And so we absolutely have to get around the idea that meaningful use is anything more than the economic driver that it was supposed to be. And as an economic driver, it did exactly what it was supposed to do, pumped hundreds of millions and billions of dollars where it needed to, but it also has distracted us greatly. So the false economy that has been created with all of this money being flooded into the system will start to peter out in the next couple of years. We already saw, for example, the regional extension centers, a lot of the grant money that was given to health information exchanges. All of these guys are realizing that the money is drying out. Now they have to get back to operational and clinical data management on a day-to-day basis. And until everybody gets onto that same mindset, it's going to end up being a larger waste of time because we end up saying, well, and I don't want to pick on Epic or Cerner or anyone else, but no single vendor can manage all of your data for you at all, especially in complex hospital systems. So we got to figure out, how do we make sure that the EHR has its place, and it's very, very good at what it does, but at the same time, how do we add on to it and make sure that we extract more value from it? So you asked, where does it have to go? If we do not see EHRs helping with cost management, helping with improvement of clinical care, et cetera, which is what the promises have always been, then it's just going to be another legacy system that we're going to be trying to tie in. And let me give you an example. So if we're doing our job right and EHRs are as valuable as we think that they should be, why is it that when a new test is ordered, the EHR doesn't tell us, wait a minute, this test was just ordered an hour ago, why are you ordering it again? So there's a lot of promises about, we're going to have these cool new features and we're going to go do this in mobile and we're going to do that here, but realistically, the things that you absolutely need. And so closest comes to, like, for example, the e-prescription systems. E-prescribing will tell you, it'll tell you when a drug should not be prescribed if you have a drug-to-drug interaction. And that's like the basic, and we're so excited about it that, drug-to-drug interaction is a major feature. But start to think and say, if the EHR is as valuable as the vendors want it to be, then what fundamental physician behavior is it altering for the better? If it's not altering fundamental physician and care behavior for the better, and it's actually making them these high-powered data entry specialists, then we've got a problem.